Why would your doctor prescribe an antidepressant or a nerve drug for menopause hot flashes? Sounds kind of crazy, right? Well, it happens all the time, and there is a reason for that. I'm going to talk about the real reason at the end of this video, but I can tell you right now, it's not because these are the best treatments for hot flashes. Well, it goes without saying, I'm going to say it anyway, but you can't start taking any prescription medication without getting an actual prescription from a licensed physician, a nurse practitioner, or a PA. But you also shouldn't stop taking a medication that your provider has prescribed for you without talking to them first. It kind of seems obvious, but I just want to make it crystal clear just how important that is, especially when we're talking about antidepressants, which we're going to cover in just a minute. Well, we're going to start with the first FDA-approved drug for hot flashes. It's called Paroxetine. Maybe you recognize that name or by its brand name, Paxil. It's an antidepressant, a type of medication called an SSRI, selective serotonin reuptake inhibitor. You might be thinking, why would my doctor prescribe an antidepressant like Paxil for hot flashes? A huge number of postmenopausal women struggle with mood changes, anxiety, and depression during menopause. So it's not really surprising that doctors reach for a drug like Paroxetine or Paxil because it can help both mood symptoms and hot flashes at the same time. Paroxetine affects serotonin levels in your brain, which help to regulate your body temperature. Researchers found out that at lower doses, it reduces hot flashes by 40 to 50%. That's why in 2013, the FDA approved a low-dose version of paroxetine called Brisdelle, 7.5 milligrams, specifically for treating hot flashes. Now, here's where things get just a little tricky. One of the biggest complaints about paroxetine and SSRIs in general is that they can seriously impact your sex life. Several studies show that up to 70% of people taking paroxetine could experience some form of sexual dysfunction. Low libido, difficulty with arousal, trouble reaching orgasm. This is especially concerning for women in menopause since libido and sexual function are often a problem during this stage of life. Paroxetine can make that problem even worse. And there's another issue, and that is weight gain. Among all the SSRIs, paroxetine is probably the worst offender for causing weight gain. One study found that paroxetine users gained significantly more weight over time compared to people taking Prozac, fluoxetine, or sertraline, which is Zoloft. And weight gain isn't just cosmetic, it also increases the risk of metabolic syndrome, which is a huge concern for postmenopausal women. Paroxetine also comes with a list of common side effects, including nausea and dizziness and fatigue or tiredness. Some women talk about feeling groggy or foggy or just plain off, especially when they're first starting on paroxetine. Stopping paroxetine can cause withdrawal symptoms like brain zaps, mood swings, dizziness, insomnia. Like every other drug that we're going to talk about, paroxetine doesn't really fix the root problem in menopause. It just manages the symptoms, in this case, hot flashes and maybe depression. So that's the first FDA-approved drug for hot flashes, but there is another one. Before we talk about that other FDA-approved drug for hot flashes, let's talk about something important, and that is off-label prescriptions. Some people kind of freak out because a drug is not FDA approved for a specific use. But here's the thing, the FDA doesn't really regulate how doctors practice medicine. The FDA approves drugs for specific conditions. That doesn't mean a doctor can't use that drug for something else if they believe it's going to help in their professional judgment. It's called off-label use, and it happens all the time. With that in mind, let's look at some off-label drugs that doctors frequently prescribe for hot flashes. Well, we have Gabapentin next. That's a drug that was never FDA approved for menopause, but it's still commonly prescribed for hot flashes. Gabapentin is actually an anti-seizure medication that's also used to treat some nerve pain. Researchers found that it can reduce hot flash frequency by about 45 to 60%, which is why some doctors prescribe it off-label for menopause symptoms. Unlike antidepressants, gabapentin doesn't affect serotonin. It actually works by calming your nerve signals inside the brain, which help reduce those sudden surges of heat that cause hot flashes. Sounds kind of promising, But gabapentin has some pretty serious downsides, especially for postmenopausal women. One of the biggest issues with gabapentin is that it can make you feel completely out of it. There are studies that show that gabapentin users frequently experience dizziness, drowsiness, and unsteadiness, especially in the first few weeks after they start taking it. One systematic review found that the risk of dizziness was 4.5 times higher in women taking gabapentin than with placebo. The risk of severe drowsiness was 3.29 times higher compared to placebo. So if you're already struggling with brain fog or fatigue during menopause, gabapentin could make that even worse. Another issue, the studies that showed gabapentin works for hot flashes used very high doses between 900 and 2400 milligrams per day. That's a lot of gabapentin, and unfortunately, higher doses mean more side effects, more dizziness, more drowsiness, more instability. Now, here's something most doctors never mention, probably don't even know about. Gabapentin may actually increase your risk of osteoporosis and fractures. A major study found that women taking gabapentin had a much higher risk of hip fractures, especially if they were older, had some frailty, or had kidney disease. Why? Because gabapentin interferes with calcium metabolism, and calcium is crucial for keeping your bones strong. Since postmenopausal women are already at risk for osteoporosis, taking gabapentin could put you in even greater danger of fractures. Gabapentin is eliminated through your kidneys, which means that if you have any kind of kidney disease or impaired kidney function, that drug can build up in your system and cause some serious side effects. Research has shown that women with chronic kidney disease who take gabapentin have a higher risk of toxicity, leading to symptoms like confusion, memory problems, extreme drowsiness once again. This is why your kidney function has to be closely monitored if you're taking gabapentin on a long-term basis. Just like the other drugs we've already covered, gabapentin doesn't fix the root problem. It just manages the symptoms, in this case, hot flashes. Next up is Clonidine, a drug originally designed to lower blood pressure, but like gabapentin, it's sometimes used off-label to treat hot flashes. Clonidine works by calming down the sympathetic nervous system, which also happens to be the system responsible for triggering your hot flashes. And yes, Clonidine does help reduce those hot flash frequencies, with studies showing about a 37 or 38% reduction compared to placebo. It can sometimes drop blood pressure too much, leading to dizziness, lightheadedness, even fainting. If you suddenly stop taking Clonidine, your blood pressure can spike dangerously high, which is why doctors tell you often to kind of taper off Clonidine slowly. A lot of women report feeling woozy or lightheaded, especially when they first start Clonidine. Some also feel sort of mentally foggy or just completely drained, which isn't exactly helpful when menopause is already making you feel tired and exhausted. Another common complaint is chronic dry mouth, which can be super annoying, and digestive issues, including constipation. Like all the drugs we've talked about so far, Clonidine is just covering up those hot flash symptoms. It does nothing to really fix the root cause of those menopause problems. But here's the real deal breaker. Clonidine can absolutely wreck your sleep. One study found that 41% of women on Clonidine had difficulty sleeping compared to 21% on placebo. Some women say it makes them wake up multiple times a night or leaves them feeling restless and drained in the morning, even if they had felt tired and thought they were going to get a good night's sleep the night before. Sleep issues are already a massive problem in menopause. Take my word for it, I get a lot of complaints about them. If anything, you need more sleep support, not a drug that makes it even harder to get sleep. All right, now let's talk about Veozah or Fezolinetant. That's the other FDA-approved drug for hot flashes. Well, this is a graphic that illustrates how a neurokinin 3 or NK3 receptor antagonist like Veozah, also known as Fezolinetant, helps reduce hot flashes. Fezolinetant is an oral NK3R antagonist that moderates NKB signaling and KNDY neuron activity, helping to restore thermoregulatory balance. I have to be honest, I have absolutely no idea what that statement means or what this graphic is saying. But here's what I do know. Veozah does help to reduce hot flashes. I may not be able to explain every neuron and every receptor that's involved in that process, but I can tell you that the clinical trials show Veozah does work. Fezolinetant, or Veozah, can reduce hot flash frequency by around 60%. That's even better than Paroxetine's 40 to 50%. It's still not eliminating hot flashes completely for most women, though. All right, now for the fine print. What's the downside of Veozah? It's pretty expensive. It's a brand new name brand drug, and that means it's pricey. If your insurance doesn't cover it, which is likely, you could be looking at hundreds of dollars a month. Not surprisingly, just like all the other drugs we've covered, Veozah doesn't replace what's missing. It just reduces your hot flashes. Some women report headaches, liver enzyme changes, and GI issues like nausea or diarrhea with Veozah. Menopause isn't just about hot flashes. It's about reversing the very thing that causes all these menopause symptoms in the first place. And yet, most doctors won't even talk about that. Why is that? Well, I suspect it's because they don't know enough about it. Most doctors barely receive any real training in menopause management. I've read some surveys that show doctors get maybe 2 hours of menopause training at most. And even when they do know about the Menopause Solution, a lot of them are simply afraid of it. They've been told it's risky. They've been warned it's dangerous. And because of that fear, they avoid talking about it at all. But what if those doctors are wrong? What if there is a treatment that not only eliminates hot flashes for most women, but also fixes their brain fog and helps you sleep better and improves your energy levels and your metabolism? What if there was something that reduces long-term health risks for things like heart disease and osteoporosis and Alzheimer's? What if this treatment had decades of research behind it? Well, still, most doctors are not going to recommend it because they just haven't had enough education. They're uninformed. Well, that's exactly what I'm covering in my next video. The ultimate solution for hot flashes and menopause symptoms. After you watch that whole video, you're going to have the clarity to make the decision about what's the right solution for your menopause. And then you can proceed with confidence. Trust me, you're not going to want to miss this video. Click here to watch it now. I'll see you there.